for some time. And what we have now is a challenge ahead of us of for some time. And what we have now is a challenge ahead of us of the bleak months of December and January, where we have a baseline of infections that literally is breaking records every day with regard to number of infections, number of hospitalizations, and numbers of deaths. The numbers are really stunning. We can do something about it, but that's something right now is public health measures, the kinds of things we talk about all the time, because we have likely a surge related to the travel and the socializing, the family gatherings, the dinners that occurred over Thanksgiving, the brunt of which we'll see in probably about another week and a week and a half, which will bring us right at the cusp of the Christmas and Hanukkah season, where there'll be yet again more traveling and more people gathering together in social events, indoors, usually. Those are the kind of things that are very precarious for essentially inducing another surge. So we have tough times ahead of us, Norah, but we need to address them by doubling down on the public health measures, wearing masks, avoiding crowds and congregate settings, keeping physical distance. If we can do that together, pulling together, as we get the vaccine rolled out, we should be okay. But it's not going to happen spontaneously. We're going to have to make the effort to do that.
The numbers are staggering that you mentioned. And Dr. Fauci, we've spoken throughout this entire pandemic for more than 10 months now. I didn't ever think we'd hit the number that we would be averaging 200,000 cases on a 7-day average, which is where we are now. It's just hard to believe in many ways. Do you see this as a direct result of Thanksgiving, that surge that you warned about?
Not yet, Norah. I think that the numbers we're seeing now might in part be due a bit, but the full brunt of the Thanksgiving has not yet been felt. It's usually 2 to 2.5 weeks following the event. And in this case, the event is the Thanksgiving weekend. What we're seeing now is our baseline of infections daily ranged between 40 and 70,000 per day. But as we got deeper into the cooler weather of the fall and the soon to be colder weather of the winter, people do things indoors. They start shopping. They start doing things that congregate them together. And that's why we're seeing what we're seeing now, which is the reason why I'm so concerned, Norah, because the blip from Thanksgiving isn't even here yet. So we're getting those staggering numbers of new cases and hospitalizations before we even feel the full brunt of the Thanksgiving holiday.
What does that mean then, the full brunt? I mean, how many cases a day is that going to be?
Well, that's up to us, Norah. That's the point. Because what we as a society now, as a nation, not individual states doing what they feel like doing, some of which do or do not comply with the recommendations of public health measures, we've got to pull together, as difficult as it is. The one thing we're all aware of is that there certainly is COVID-19 fatigue. People are worn out of being shut down and not allowed to do the things that they really would enjoy doing, particularly during the holiday season. But you don't have to shut down the entire country or shut down the economy. You can do some things that would allow you to keep the children in school, to keep shops and commercial venues open. But you don't want to do things that are asking for trouble. And those are the things that we know so well, the congregating in crowded places with no masks, such as in bars and parties that are indoor with no good ventilation. Those are the things that drive it. In addition, what we're seeing now, which was a bit unexpected but true, is that even modest size gatherings of family and friends in a home with obviously the indoor constraints of not getting good ventilation, we're starting to see infections that are emerging from what otherwise seem like benign settings, namely a typical gathering of 10 or so people in a social setting. We've got to be very careful about that now over the next few weeks.
Yeah, and you said that Christmas could be even more of a challenge than Thanksgiving. How so?
Well, when you look at Thanksgiving, you have people traveling. They may travel on a Tuesday, get to where they want to be on Wednesday, stay for Thursday, Thanksgiving, and then go home to the other place wherever they came from on a Sunday night. That's a very brief period of time of travel and congregating. When you're talking about Christmas, generally you start a few days before Christmas, the 22nd, the 23rd. You go through Christmas and Hanukkah. You go through the week between Christmas and New Year's, and then you have another celebration on New Year's. That extends that vulnerable period by 2 or 3 times what you do in Thanksgiving. That's the reason why the Christmas issue bothers me even more than Thanksgiving.
And how will your plans change for Christmas? Are you also not going to be able to see your family?
Yeah, they've dramatically changed, Nora. As I had mentioned publicly, I would have loved to have seen my 3 daughters who are geographically scattered throughout the country over Thanksgiving. They did not travel for the reasons that I just mentioned to you. And we made a decision just a few days ago as a family that for the first time, you know, I have 3 daughters in their late 20s and early 30s. And for the first time in more than 30 years, I'm not spending the Christmas holidays with my daughters.
Yeah. Same with my parents. They came over. We went for a walk outdoors with our masks on, and then they did not stay for dinner. So it was only an outdoor, you know, just to be extra careful. And that was really hard. I thought maybe once they smelled the turkey that they couldn't leave, but they were disciplined and certainly said, "I'm sorry, we have to stay safe."
That was a wise decision, Laura. That was a wise decision.
I know, difficult, certainly for many families that made that decision as well. I want to ask you about the IHME model, because the people that follow this closely, they know what that model is. And researchers there are projecting nearly 3,000 deaths a day by the middle of January. Does that modeling seem about right to you?
You know, it does. I mean, models are as good as the assumptions you put into the model. So they're making the assumption that what we're going to see is travel. What we're going to see is people congregating in social settings in the home. And that's the reason why I say, although the model with the assumptions that are put in are very likely correct, we don't need to accept that. We can change the assumptions that are put into the model. So we can do things like, although it is painful, inconvenient, and sad, we can double down on blunting some of that by avoiding some of the things as warm and pleasant as they are during the holiday season, to do much less of that and try and keep the gatherings to people within the immediate household. And if you have other people come in, be very careful. Hopefully they may have been tested, so you know that very recently they were negative. Or they have their own bubble where they're very, very careful in themselves protecting themselves, so that when you get together, there's much less of a risk than someone who just gets from an airport or a train station, gets in an Uber, comes to your house, sits down, and then you have a social setting. You have no idea who they were exposed to. Those are the things you have to avoid.
You know, when this pandemic started, I can remember you from the White House briefing room talking about the 15 days and then the 30 days, and it was all about flattening the curve. The idea that if we socially isolate, distance, some called it a lockdown, whatever you want to call it, that would help, of course, flatten the curve, the number of infections. The big news today, California. 33 million Californians are now under new stay-at-home orders today. What effect do you think that will have?
Well, I think that's going to rescue them from possibly getting their hospitals overrun. I have spoken in detail to the health authorities in California. They are in and were in a very difficult situation, Nora. They were right at the cusp of having the hospital beds be overrun in the sense of not having enough beds, not having enough trained personnel, particularly intensive care. They made a difficult decision, but I believe it was the prudent decision where they said, you know, if we keep going up at the rate we're going, very soon our hospital system, our public health system is going to be stretched to the maximum. So now's the time to call a timeout, shut down, not indefinitely, but just enough to add some flexibility to the hospital system. Otherwise, they could be in significant trouble. The one thing you absolutely want to avoid in this country, this modern wealthy country, is to have to not be able to take care of a patient whose life depends on your care. That would be a horrible situation to be in.
So what other places are close to where California is?
You know, I don't know, but you look at the map, Norah, and you see the heat map, they call it. What's red is when there's a lot of cases. Boy, there's a lot of red on that map. So I haven't spoken directly to every one of the states there, but the ones that I have are all in a comparable situation to California.
So you don't have a specific state right now that you think could benefit from another stay-at-home order?
No, I don't want to say that, Norah, because I don't want to get ahead of them. They're on the ground no better than I am.
And without being specific, what about political leaders that say, you know, you should stay at home, you shouldn't do this, and then they go out and travel themselves for the holidays or go out to restaurants and indoors? I mean, is that setting a good example?
No, of course not. That's a bad example, and several of them, as we know from the news. I was watching the news last night. Unfortunately, some of them did, but they were caught at that, and it was very embarrassing on their part, and thankfully they were very contrite about it and went back and said they would never do that again. We do need good examples from the leaders.
I do want to make sure we get to the issue of schools. This is so important to so many people. You've seen the studies out there. I mean, we're seeing students struggling with remote learning. More failing grades, attendance is a challenge. I mean, Houston, Texas, 42% of Houston Independent School District students failed one or more classes in their first grading period. Why isn't there some national plan about getting kids back in school? This is harming our future.
Well, you know, I've been saying this for some time now, Norah, that the default position we should have is to bring the children back to school or keep them in school, because what we have found out, and there's another example of when you get data and the data is hard, solid evidence, you can act on it, even though it's different than what you may have assumed a few months ago before you had that data. It looks like now that the test positivity of children in school compared to the comparable community is really relatively low. So it seems now maybe counterintuitive that the safer place to be for the children would be in school, because the test positivity is really relatively low. So that's the reason why we should do whatever we can. Obviously, not every one size fits all, but with some exceptions, we should try as best as we can, but also to provide the support for the teachers to allow them to safely conduct classes in person. They may need additional resources. So when you look about whether locally or federally or what have you, the resources that might be needed, we should be making those resources available so that we can safely keep the children in school.
Why aren't teachers going to be some of the first to be able to get the vaccine?
You know, that's a good point. They're not on the first level, but they're there after a couple of levels. That does make sense because, you know, several of the, percentage, I don't know exactly what it is. It varies from location to location, that teachers, either because of their age, but more likely, some of them, many of them are young. My own daughter is an elementary school teacher in New Orleans, that she tells me that there are people who have underlying conditions who are on the faculty of the school. You've got to be careful. You want to make sure you protect them and they get vaccinated.
Got it. Let's talk about the vaccines, because everyone is hoping that this is the light at the end of the tunnel. And I know you've worked so valiantly in this effort, so thank you. This is the most ambitious vaccination project ever undertaken, not only in the United States, but probably the history of the world. Are you confident that the U.S. has the supplies and the personnel to be successful?
Yeah, I am, Norah, I am. I'm not responsible for it myself, but I have been working within the context of Operation Warp Speed from the very beginning, which is that combination scientific and logistic approach towards making sure the vaccines which have been produced are safely and efficiently transported to the local places where they will be distributed, and that the local authorities, state and city authorities, have the responsibility to make sure that the vaccine is efficiently and equitably distributed according to the prioritization that comes from the CDC with the advice from the Advisory Committee on Immunization Practices. I've seen, I've seen the plans. I can't guarantee it because I'm not doing it myself, but I'm pretty confident that it's going to work out okay.
Well, the reason I ask you is President-elect Biden made a number of headlines last week when he was asked about this. He said there's, quote, no detailed plan about how you get the vaccine out of a container into an injection syringe and into somebody's arm. So is there a plan, and has just the new administration not seen it?
Well, the way the situation is going to be rolled out, Norah, according to what I have heard in my dealings with Operation Warp Speed, is that the actual transportation, getting the material from the warehouses where they're stored after filled and finishing, getting it on a train, on a truck, on an airplane, going to the local areas, the cities and the states. Once there, each individual city, state, public health authority have their own plan about how they're going to distribute it. So I think what they were talking about is that not a broad national plan, but it's left to the individual states and local authorities about how they're going to actually do, as you say, get it. Well,
not all states are equal, though. I mean, I'm sure some states are far more prepared than others. That's not necessarily reassuring. That it's just up to the states.
Yeah, well, it is. That is the reality of it, that the distribution of these are going to be left at the local, state, and city level.
Mm-hmm. You've in some ways become the barometer for vaccine safety, and President-elect Joe Biden, former President Barack Obama, former President George W. Bush, Bill Clinton have all said they will get the vaccine if you say that it is safe. So can you promise them that the vaccine is safe?
Yes. When I look at the data, when I've looked at much of the data already, that I think what people need to understand is that the decision that the vaccine is safe and effective is made at a number of steps that are both independent and transparent. Very quickly, what happens is that when the data are looked at by an independent data and safety monitoring board of trusted individuals who have no allegiance to anyone, not to the administration and not to the company, they looked at the data and they found that the vaccine was safe and effective. That data then goes to the company, which then brings it to the FDA, who together with their own advisory committee determines whether an emergency use authorization and ultimately a license should be given. All of that, Norah, is independent of outside influences. And it's very transparent because the data upon which they base that decision will ultimately become totally public in a peer-reviewed journal. So when I see the FDA with their career scientists say that a vaccine is safe and effective, I will take it myself when my time comes, and I will recommend it to all people, including my friends, President Clinton, Obama, Bush, and others, to take the vaccine because I would feel comfortable taking it.
And would you be willing to take it on television, maybe CBS News, because Elvis did it on CBS News way back in the day?
You want a commitment to a network. I don't know if I can give that, Norah, but I'd be more than happy to do it publicly.
Got it. Okay, let's tick through because a lot of your job has been myth busting, if you will. There's a lot of questions and misinformation out there. Do we know how long does the vaccine give you immunity from getting sick from coronavirus?
We don't know the answer to that, but we will find out because we're so early into the process. We don't know what the durability is, but we're going to find that out for sure.
Do you expect that the vaccine will be like a flu vaccine, meaning you'll have to get a new shot every year?
I'm not so sure it'll be every year, but I would be surprised if it gave lifelong immunity the way the measles vaccine does. I think we likely would have to get boosted. What the interval of those boosts are, I don't know right now.
Okay. Both Moderna and Pfizer are new technology. They are the mRNA technology. Some people have said to me, I don't know, I don't trust that. That's new. I don't know what that mRNA is. What can you tell them to say, no, this is safe, and this could also be the future of vaccine research?
I think the last thing you said is true. It could be the future of vaccine research.
Including anti-cancer vaccines, right?
Absolutely, absolutely. The one thing we do know that the efficacy is extraordinarily good. 94 to 95% is about as good as it gets. The gold standard is measles vaccine, which is 98% effective. We do know that it is virtually 100% effective against serious, severe disease. That's really good news. Is it safe? Well, the overwhelming majority of adverse events that are intermediate or late occur within maybe 30 to 45 days following the vaccination. The FDA will not issue an EUA until they were 60 days beyond the time when half of the people received their last dose. So we're already well beyond the period when the overwhelming majority of adverse events occur. So it looks like it's pretty safe, Norah, as well as being highly efficacious.
This is a question from Jan in Arizona who says, will people who have already had the virus be recommended to get the vaccine as well?
The answer is yes, because once you get infected with the virus, it isn't certain how long that protection would be or whether or not you mounted good protection. So it isn't a contraindication against the vaccine if you've already been infected.
President-elect Joe Biden has said he would like for you to be his chief medical officer and advise him. I know you have accepted on that. What's the first thing you would like the Biden administration to do?
Well, I think the first thing is to make sure that we, and you just pointed it out yourself, that we get the efficient and equitable distribution of vaccines, and we get people, as many people as possible. So if there's one thing we want to jump all over, is literally do a full court press to get out there, engage the community. Because if we could get 75 to 85% of the people in the United States vaccinated, we could crush this outbreak before the end of this year. We really have the capability of doing it. We've just got to go out there and grab it.
Dr. Fauci, the new year is approaching, and the new year is always a time to reflect about what's behind us and also look forward. So what's the one thing that you are most proud of, and what's the one thing you regret?
Well, the thing I'm most proud of is the work that my team and I did, mostly my team, because they're the ones that are doing it, in playing a major, major role in the successful development of the vaccine, because the platform itself, the spike protein and all of that was done by scientists that are right here at the NIH, as well as grantees and contractors throughout the country. So as director of the institute that funds that and sees the research get done, that's what I feel the best about. What I regret, I don't know if it's regret, but what I don't feel very good about is the fact that we have so many cases of new cases, hospitalizations, and deaths. And whenever you see that, and you're a public health official, you always ask yourself the question, could I have done better? Could I have done something different a little bit sooner or what? And the answer to that is likely that's the case, that we were imperfect in our response. And that's just something you have to live with. Hopefully, as we look forward, we'll make up for that.
Do you feel like you had the support of people in the White House?
I do. I mean, I think if you look at Operation Warp Speed, that's a very successful endeavor. No one can take away from that. That was is a very successful endeavor.
Well, one thing that I noticed is something they're now calling the Fauci effect. And that is, this year, they have seen a surge in applications to medical school. People want to be doctors, and they're attributing it to you and others who've been on the front line of that. So how does that make you feel that there has been the Fauci effect?
Well, I think it's a lot more than the Fauci effect. I think what people throughout the country and even the world are seeing, that at every level of the medical and scientific professions, that they have performed admirably. I mean, to have a vaccine available to go into people within the next couple of weeks in less than a year from the discovery of this new virus is beyond incredible. I mean, it's just extraordinary. It will go down, Norah, in the history books. I'll guarantee you that it was done so quickly. And then there's the incredible bravery of the doctors and nurses and healthcare providers who put themselves on the front line every day, risking their own health and those of their families to take care of desperately ill patients. I think when young people who want to think about something they want to do with their lives think about that, I think it's going to be less the Fauci effect and more the COVID effect, that there's so much good you can do in the scientific and medical professions.
Mm-hmm. Just like after 9/11, when we saw so many people want to join the military to defend this country and fight for this country and serve in the esteemed U.S. military. Well, Dr. Anthony Fauci, it's always good to see you. What's your favorite part of the upcoming holiday season?
The favorite part is my birthday is Christmas Eve. So we're going to have a Zoom celebration with my wife and I in my house and my children scattered throughout the country. That's the first time ever that I have not been with them for my birthday and Christmas Eve. But we'll get through it. We'll have some fun.
And it is public knowledge, so I don't feel bad asking this. How many years young will you be?
80.
Congratulations. And I hope that it's a joyful Zoom celebration. Happy birthday. Thank you for your time, and we appreciate it. And as does the Milken Institute. Thank you.
Thank you for having me, Norah.